911 emergency. What's your emergency?
Yes, I'm experiencing some pain in my chest.
1823, code 3 to Fairview Ridges at 1122.
Healthy's 911 service safely transported more than 1,000 patients in the past year alone to the emergency department at Fairview Ridges, and dozens of transports to the other Fairview hospitals.
We've had a long history with Fairview. Health East has been a provider in the Dakota County in our public service area for almost 100 years. And we have been delivering patients from our 911 service to Fairview. It's one of our busiest receiving hospitals from the Dakota County public service area that we service. And so our paramedics are very comfortable bringing patients to Fairview, and I believe the Fairview staff have been very receptive to the care that our medics have been providing.
Fairview is a community-based healthcare system in Minnesota whose vision is to be the best healthcare delivery system. It's a vision that's shared by Health East Medical Transportation.
We transport patients across the entire age spectrum. So from the tiniest infants, neonates in isolettes, obviously to elderly patients, from wheelchair transport to critical care transport. Even patients who are being treated with therapeutic hypothermia can be transported safely across the entire continuum of care.
Health East is in the top 5% of the nation as far as safety as related to patient transport. And when we instituted the road safety program, we created a program that ensures safe but efficient transport of patients, even when we're going lights and sirens. And over the years since we've incorporated that, our safety record is absolutely unparalleled in the industry.
Our team of medical directors works closely with the paramedics and with the EMTs to monitor their performance. There's always a physician available by radio or cell phone if the paramedics or the EMTs have any questions or concerns. We have very well-developed clinical protocols for them to follow, and they're very well trained in those protocols. But sometimes things happen and they need the advice of a physician, and that's always available from our medical directors. We've worked very hard in our transportation division around integrating the quality work that we do throughout Health East with the quality work that we do in transportation, and trying to integrate that with the facility that they came from, if they're an interfacility transfer, through the time that they're in the ambulance until the time that they're received at the facility, and making sure that we have a seamless level of quality across that entire experience for the patient.
And that's not only just at our patient-to-patient encounters, but also our relationship with the facilities themselves, the staff that work there, even all the way down to our billing and our fleet management, and all of the ancillary services that we have to support the actual patient care delivery is committed to providing the very best. We are actually celebrating our 100th year in business, which is the longest running ambulance service in all of Minnesota. And to commemorate that, whether it was coincidental or not, we moved into our brand new facility here in St. Paul, a huge expansion. The ability to have all of our fleet indoors significantly reduces our operating costs and allows us to be able to be more proactive and be able to meet the demands, such as Fairview, when they call and ask for that help.
In 1801, you're responding to a 56-year-old male.
We have a state-of-the-art sim lab with using Laerdal ALS simulators. So we have that capability to provide hands-on education to all areas of pre-hospital and hospital education. This is a hospital and a system that is so close to the area that we service their patients. It seems only natural for us to go the next step and to offer that type of, compassionate and caring and respectful transfer of those patients to other facilities.
We've had a great relationship with Fairview for many years. We've transported their patients. So I think expanding on that and formalizing that relationship and again, integrating the quality work we do with the great quality work that Fairview does, it's a natural fit.
I believe strongly that Health East can provide Fairview exactly what it's looking for: safe, compassionate, and respectful care for their patients. We have the ability and the flexibility to meet their needs, and we have a fleet that is fully capable of doing that, and dedicated providers that I am extremely proud to be their medical director. And all of that combined is what will offer Fairview the very best for patient care.